All right. So fatal junkies had to be rushed by ambulance to the nearest hospital in cardiac arrest or with life threatening strokes or seizures, records show. On Point, the nonprofit that operates the two so called safe injection sites, y'all, in Harlem and in Washington Heights, doesn't keep track of what happened to these people or if they died. So you have people coming into a site, right? It's a nonprofit, right? Orchestrated by a nonprofit called On Point, okay? And this nonprofit takes people that actually do certain pharmaceuticals, right? That illegal pharmaceuticals that they will take you in to prevent your drug usage. Okay, so they are attempting to bring you into a facility, and whatever your drug of choice, they will administer that particular drug of choice to you. Okay, let's carry on real quick. Let's carry on. This is quick. Let's carry on, and then I'm gonna get into all of this. Now, the city health department, which over now the city health department, which oversees the two safe injection sites, refused to answer whether it keeps track of the outcome of the 46 people rushed to either. Now, overdoses at the center, meanwhile, went up 7% from 636 to 683 between their first and second years, according to On Point's newly released annual report. It reveals that 3,156 junkies visited the centers 61,184 times in 2023, the most recent year for which data was made available. That's up 26 from year one, when drug users walked through doors 48,533 times. There was also an increase in repeat visitors, with 177 clients coming in to do drugs more than once a day in 2023, up 108% from 77 in 2022. We increased the overall number of visits and frequency of visits to overdose prevention centers. These significant successes, On Point bragged in its annual report. Crack was the drug of choice among On Point users, with it being smoked as many as 56,175 times over the 2 year period, followed by heroin, which was injected 48,714 times. Cocaine was snorted 30,721 times, and speedballs, a dangerous mix of heroin and cocaine, were injected 19,651 times. Okay? Okay? Tell me you understand what's going on right now. Tell me you smack that like button also. Tell me you understand what's going on right now. These people are coming into these drug facilities masquerading as prevention centers, allowing people who smoke crack to come in and smoke crack. Now they have increased the frequency. They can come back multiple times a day to smoke crack. These people have somehow literally made it legal to smoke crack, made it legal to sniff coke, made it legal to shoot heroin. Okay? They're showing you their data right there from these two centers that they have put in New York City, in Harlem, and in Washington Heights. And that's in Manhattan. Okay? I am just totally, disgusted. Just livid to have learned this. You should be out of your mind livid that our government, which is not our federal government, but our governments, which is the democratic part of the government, is allowing these people to build legal drug centers. Legal drug centers. You probably thought they were out of their mind when they actually allowed liquor to be legal at some point, right? This is it doesn't get no higher than this level of deceit and just flat out scamism. They are these people have found a way to legally write up a program that will be able to administer crack to people legally. Are you kidding me? Tell me you kidding me. Tell me you're kidding me. Tell me you're kidding me. Smack that like button. Smack that like button. Tell me you're kidding me. These people are administering crack to the community, bro, legally in New York City. People are all over the streets, laid out. Yo, bro. Yo, man. Check this out. Alarmingly, use at Washington Heights location more than doubled between year 1 and year 2, from 19% to 44% in Harlem. The rise was more modest, from 5% to 7%. Critics have long blasted the centers as keeping addicts hooked on drugs rather than getting them clean. Just what I said, abso-freaking-lutely. Who can't see that? This is illegal. This is illegal. This should be massive protest against this. This is just absurd. Okay? This is absurd, man. Critics have long blasted the centers as keeping addicts hooked on drugs than rather than getting them clean. It's like they've continued to do something that worked at a greater scale. Oh, excuse me. It's like they've continued to do something that doesn't work at a greater scale. That's nice. But there's no measure of outcomes, which doesn't surprise me because the outcomes will look good, said Charles Lehman, a public policy expert at Manhattan Institute. The report notes that 14% of patients received services related to bromphene, a treatment for opioid addiction, which includes education, screening, and counseling, but doesn't break down the number to say how many actually agreed to receive treatment. That could just mean they were given a brochure, slammed Lehman. They're not demonstrating they're getting people into recovery, which is best case scenario of services like this. I don't think they seem particularly interested. Okay, so he's saying they don't. I don't think they seem